Hi everyone, this is Alex from Salmonella Place and I am back again with another pharmacology lecture. So today's lecture is all about prescription writing, drug compendia and drug names. I hope you enjoy this, I hope you find it really helpful. If you have any questions, please comment below this video or send us an email at info@salmonellaplace.com. That's info@salmonellaplace.com. So guys, on my first slide, I'm just going to explain a little bit about the different types of drug names and what a drug compendium is. So you have a generic name. This is the internationally recognized name. So in every country, it's going to be the same and people will know what it is. Now, then you have the trademark name, which is taken by an individual drug company and they copyright it, so only they can use it for a certain amount of time. This is different depending on which drug company you use, which country you're in. So if you say it and you're in another country, they might not know what it is. But the generic name is the basis, so always go back to that. And then the third one is the chemical name. This is actually the chemical structure, and it's a really, really long name, which basically describes what atoms are in the structure, how they're connected, blah, 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 all of this stuff that we don't need to really know as doctors. That's more for pharmacy, but if you do have an idea, it's great. And the last thing I'm going to say on this slide is about the drug compendium. Drug compendium is this big, big book which is brought out in print every 5 to 6 years, and it's got different types of people editing it, you know, doctors, pharmacists, basically people who aren't directly linked to the drug companies, and they give you all the information on the drug, the really rare side effects, everything you need to know if you're treating a patient with this particular drug. So it's just like a encyclopedia or a hardback reference for all of the medicine you're going to be using. So guys, now I'm going to talk about prescription writing. A prescription is a medico-legal document, and it's an order that is sent from the doctor to the pharmacist. So when you go to the doctor, you complain about your ailment, they will write down a prescription. Once they've diagnosed you, you'll take it to the pharmacist will read it, and depending on what kind of drug you're prescribed, he will either make it up for you. This is a compounded drug, and it's less than 1% of the prescriptions that are out there, because usually we use pre-compounded drugs which are made in a pharmaceutical factory. What will happen is, if it is a compounded drug, the pharmacist will go upstairs to his lab, make up the concoction according to the direct orders of the doctor on the prescription, and then bring it down for you. It could be ready immediately, you might need to wait till the next day, really depends on the drug. On the prescription, you will see the date, and it will also have an expiry on it. In some countries it's 3 months, some 6 months, it really depends where you're working. You also have the name, age, address of the patient. You will have directions to the pharmacist from the doctor. You will have directions for the patient from the doctor and therefore from the pharmacist. They need to be simple so that the patient can be compliant. So therefore not too complicated, not too long, otherwise some patients won't read it, some patients won't understand it. It just needs to be bum, 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 so many times a day, so many times a week, apply here, drink this, do that, very, very simple. And then at the bottom you're going to have the date that the prescription was issued, the signature of the doctor and the official seal or stamp of that doctor. This makes it a medical legal document. Now guys, lastly, I want to talk a little bit about the controlled substance order. These are a list of 5 different schedules where some drugs have been documented according to their abuse risk. So for example, schedule number 1 are completely illegal drugs. This is like heroin, LSD, they're hallucinogens and opiates, and they're not prescribed by doctors or anybody. So that makes them completely illegal. Schedule number 2, these are drugs that have an extremely high abuse risk. So they are prescribed rarely, and they're the patients are watched over by the doctor a lot to make sure that they aren't abusing the drug. These drugs are narcotics, amphetamines, and certain types of barbiturates. Schedule number 3 is depressants, certain types of narcotics, and other types of barbiturates. These are a low physical dependence, but high psychological dependence, so therefore they are an abuse risk. Schedule number 4 is again certain types of barbiturates, paraldehyde and chlorhydrate. These ones have mild CNS depression and some psychological dependence. And then schedule number 5 are drugs that have a low abuse risk, but then again there are cases that have been seen to where patients have abused it, and that's why they're in the schedule. For example, codeine. This is an antitussive, certain types of antidiarrheal drugs, and certain types of opioids. So guys, I hope you enjoyed this lecture. Like I said at the beginning, if you have a question or you want to tell me about something, comment below this video or send me an email at info@salmonellaplace.com. That's info@salmonellaplace.com. See you next time. Bye.